Hello, and welcome to our series of lectures in fetal circulation. In this particular lecture, we are going to talk about the fetal circulation, the circulation per se. So, the source of oxygen in utero is the placental blood, and there are multiple levels of bypasses which exist within the fetal circulation. And once their role as a bypass is over, these bypasses they persist as certain structures. So right here in the particular illustration, we can see the source is the placenta. Placenta has the two arteries. We can appreciate two arteries here, and it has a single umbilical vein, right? So through the umbilical vein the oxygenated blood, so blood in this umbilical vein has around the partial pressure of around 30 millimeters of mercury and saturation of around 80 percentage saturation is there, whereas the umbilical arteries they are carrying the deoxygenated blood from the fetus, from the body of the fetus. And there are basically three levels of shunting which are occurring within this fetal circulation. So the blood through the placenta goes through the umbilical vein, and from the umbilical vein there is a first level of bypass. So there is a duct which connects the two venous circulation. The first vein is of course the umbilical vein itself, and the second vein is the inferior vena cava. So the vein which connects the duct which connects the two veins, the inferior vena cava and the umbilical vein, that is ductus venosus. This ductus venosus later persists as the ligamentum venosum. This later persists as ligamentum venosum in the postnatal life. Now we have the blood that has been shunted through this ductus venosus. It bypasses the hepatic circulation, and through this inferior vena cava the blood now reaches into the right atrium. In the illustration we can see the right atrium right here. The blood has now reached into the right atrium is receiving blood through the two conduit. The first is through the inferior vena cava, and second is through the superior vena cava. So let's first complete the first circulation. So the blood from the right atrium now it bypasses the right ventricles and it enters into the left atrium through this opening which is known as foramen ovale. The foramen ovale in the postnatal life it persists as fossa ovalis. Now the blood from the left atrium it passes into the left ventricle, and from the left ventricle through this ascending aorta it enters into the circulation, which provides the blood supply to the head and upper part of the body of the fetus. The blood then eventually enters into the heart again through this superior vena cava. So the superior vena cava is carrying the deoxygenated blood from the upper part of the body and head of the fetus, and the inferior vena cava was carrying the oxygenated blood from the lower part, from the placenta, let's say. And now the deoxygenated blood which was entering through the superior vena cava now enters into the right ventricle, and from the right ventricles it enters into the pulmonary trunk. So here in the picture we can appreciate the pulmonary trunk here. So through this pulmonary trunk, within the fetal circulation, within the fetal life itself, the pulmonary vessels they have the very high resistance vessels, and also the lung is flooded with the amniotic fluid. Therefore, the fetus blood bypasses the pulmonary circulation with the help of a duct that is known as the ductus arteriosus. So a ductus arteriosus means it's a duct which connects the two different arteries. The first artery is pulmonary artery itself. So here we can see the pulmonary artery itself, and another artery is the descending aorta. All right, so we have a descending aorta that is being connected with the pulmonary artery with the help of a duct known as ductus arteriosus. This ductus arteriosus in the postnatal life persists as ligamentum arteriosus. All right. So during just after the birth, when the fetus takes the first breath, the pleuring of the pulmonary alveoli, starts to clear off through the lymphatic circulation. Now whenever the now when the resistance within the pulmonary vessels is being decreased, and also the source of there was constant source of the prostaglandin. We know the prostaglandin E1 and prostaglandin E2, it keeps the ductus arteriosus in open state, because these prostaglandins, they are the vasodilators, they dilate the ductus arteriosus vessels and they keep the ductus arteriosus open. But after the source of the prostaglandin, that was the placental source, once the placenta has been set off, once the placenta has been out of the body and the prostaglandin has been cut off, these prostaglandins, they no longer keep this ductus arteriosus open. And when this ductus arteriosus is now closed and the resistance within the pulmonary vasculatures has been decreased, now there comes the roles of the pulmonary circulations. Now the pulmonary circulations, they come into act, and the fetus and the source of oxygen within this fetus, within the body of the fetus, is now through these pulmonary channels. So at birth, infant takes birth, there is decrease in resistance in the pulmonary vasculature, there will be increase in the left atrial pressure versus in the right atrial pressures, which closes the foramen ovale. Now the foramen ovale, once closed, it is now is known as the fossa ovalis. And also there is decrease in the prostaglandin and increase in the oxygens, and that closes the ductus arteriosus. And we have certain drugs like indomethacin. The indomethacins and other drugs like NSAIDs, these block the synthesis of the prostaglandin. And whenever we have cut off the prostaglandins in the fetus in utero, then the ductus arteriosus will of course be closed. So the generally the NSAIDs are contraindicated during the pregnancy itself. Now we have talked about the postnatal remnant of all the structures, except these two. The umbilical vein, the umbilical vein was joining the placenta with the liver, so it will remain as the ligamentous teres hepatis ligament of the liver. Now the umbilical arteries, they remain as the umbilical arteries, the limit is the umbilical for medial, umbilical is medial umbilical ligaments. So all these for the embryology as fetal circulation for step 1. Thank you.